guys, hope you all are well. The skill I will be teaching you on today is how to assess cranial nerves 11 and 12. So I'm going to begin with cranial nerve 11. Cranial nerve 11 is also called the spinal accessory nerve, and it controls neck and shoulder movement. This image gives a visualization of all 12 of the cranial nerves. You can see the accessory nerve is near the bottom and it is shown in green. So to test this cranial nerve, you're going to ask the patient to shrug their shoulders with and without resistance. You'll apply resistance by putting your hands on their shoulders. And this tests the trapezius muscle. You will also ask your patient to turn their head from side to side with and without resistance again. And this tests the sternocleidomastoid muscle. So damage to this nerve can be from neurogenic etiology, direct blunt trauma, or penetrating trauma. Further investigations of damage can be done by X-ray, CT scan, and ultrasound to provide imaging of the internal damage, as well as electrical stimulation of spinal roots and transcranial magnetic stimulation to evaluate the nerve function. So next, cranial nerve 12, which is also called the hypoglossal nerve, is necessary for tongue movement. Here's that image from before again. You can notice the hypoglossal nerve at the bottom, and it is shown in light orange. So cranial nerve 12 is mainly an efferent or motor nerve, as it controls the movement and muscles of the tongue. This nerve has 4 branches: the meningeal, descending, thyrothyroid, and muscular. However, the muscular branch is considered the real hypoglossal nerve due to starting from the hypoglossal muscles, while the other branches originate from spinal nerves or cervical ganglia. This nerve sparks the muscles of genioglossus muscle, which moves the tongue forward, hypoglossus, which retracts the tongue and lowers the sides of the tongue, styloglossus, which moves the tongue upward, and intrinsic muscles, which include superior and inferior longitudinalis, transversus, and verticalis, and these change the shape of the tongue. So to test cranial nerve 12, you're going to ask the patient to protrude and retract their tongue, move it side to side, and up and down. So each movement should be done twice, once slowly and the other rapidly. Strength can also be tested with this cranial nerve by applying resistance with a tongue blade or depressor in opposite force of the tongue movement. So one example of why this nerve's function is important can be seen in patients with obstructive sleep apnea, because they have decreased muscle tone of the genioglossus muscle. It results in the tongue falling back and blocking airflow into the trachea. So common treatments of patients with obstructive sleep apnea include continuous positive airway pressure, CPAP, oral devices, or surgery. But hypoglossal nerve stimulator is also an option because it will cause the tongue to be pulled forward, providing better airflow. So, as a quick recap of how to test cranial nerves 11 and 12, cranial nerve 11 is called the spinal accessory nerve and is tested by having the patient raise their shoulders and turn their head side to side with and without resistance. Cranial nerve 12, which is also called the hypoglossal nerve, is tested by having the patient move their tongue, protrude and retract, side to side, up and down. All right, I hope this video helped you understand how to assess cranial nerves 11 and 12 a little bit better, as it is important to the patient care we provide. I will be posting my questions in the discussion board, so be sure to check those out, and I hope you'll have a great day.